Bueno. Awesome. Great. Now I'm being recorded. This is for educational purposes, right? So I'll wait about another minute or so, and I'll get the webinar going and kind of discuss with everybody there. As I said, the ways and potential ways to get rid of sleep apnea, that nagging sleep apnea that seems to just never give up on people, huh? Just wait a moment, see what I can do. Everybody's having a great day. I've had a pretty solid Tuesday for what it's worth. I had this conversation about getting rid of sleep apnea with a few patients today, actually. Discussed a couple of these techniques that I'm going over with you, and I'm going to go over with you in conversation, and I just always see what somebody's going to do about their sleep apnea. So, all right. If anybody pops in a little later, we'll take care of it. But I'm Andrew Nabors. I'm a respiratory therapist and clinical sleep educator here at Valley Sleep Center. I've been with the company for about 7 years. 7 years at this point. Crazy. And my primary goal here is to help anybody with their sleep issues, particularly their sleep apnea. Dealing with sleep apnea is generally a chronic, lifelong issue, but there are ways to alleviate and eliminate sleep apnea of your life. It's not always a dead set, steadfast guarantee you have sleep apnea, you're always going to have sleep apnea and it never goes away. That's not necessarily true. There's methods and techniques, and certain patients have different scenarios or situations that they can, I guess you can say, benefit for trying different therapies besides just the world of CPAP. So the slides I'm going to go over is going to present a multitude of different options. And of course, if anybody has questions, you can put it in the chat, or you can do in the question and answer. And then I will answer any particular questions live through the webinar, through the Zoom when we finish up. So let me get this moving for y'all. Okay. Is it possible to get rid of sleep apnea? Good question, right? Obviously, so millions of people do, of course, suffer from sleep apnea. I've read some studies and statistics about sleep apnea, and there's one study that populates that says 1 in 5 Americans suffers from sleep apnea, right? I look at that and go, wow, that's a lot of people. And then you think of America as a whole, we're pretty much a conglomerate of multitude of different races and denominations. So I look at sleep apnea as more like 1 in 5 people in the world are going to suffer from some sort of sleep-related breathing issue at one point in their life, whether it's a weight gain sort of thing, it's a medication sort of thing, it's a pregnancy sort of thing. Some stuff could just populate. Sleep apnea can trigger lots of people. And curing it can be sort of complicated. There's certain methods that can help. This diagram here, of course, shows the general concept of what sleep apnea is. You have the air coming in through the nose or the mouth. You have the tongue and the soft palate in the back of your throat closing off and preventing air from moving into the tracheal windpipe, causing disturbances in your sleep, and of course, oxygen levels dropping and such. Now, sleep apnea is short pauses in your breathing. In order for us as a sleep provider to even register and count an apnea, physically breathing has to stop for at least 10 seconds. There's oxygen desaturations, your oxygen levels are going to fall, carbon dioxide levels are going to go up, and your body basically freaks out because you're not breathing well. You're not taking enough oxygen, you're going to gasp and choke, and that's pretty common clinical symptoms. Although most people with sleep apnea really have no idea they have it. Like, it's super common for a person who has sleep apnea to say, yeah, I didn't even know. And the only reason they're here is because their wife, their husband, or their doctor, or somebody said, you need to go and do this. So more often than not, it flies under the radar. You also get used to the way you sleep and the way you are as a person. So sleep apnea to you is normal. Most people, it disrupts their sleep and they can feel kind of brain fog. They can feel sleepy and tired during the day, waking up multiple times in the night. Sleep apnea has a lot of health issues, of course, which is, just it can trigger a lot of mental health problems like anxiety, stress, depression. It affects your immune system, which is obviously incredibly important for a human body. It affects memory loss, and it can increase your risk of heart failure amongst a multitude of other health issues. It's just a little snippet. Okay. Now, these are some sleep apnea lifestyle remedies that anybody can do. This isn't something that's just particular. Well, some people might not be able to take part in this, but the majority of people with sleep apnea tend to have weight to lose. Okay. Maintaining a healthy weight can help reduce any sort of sleep apnea like symptoms. Obesity, particularly in the upper body, in the neck, and the throat, can lead to the airway obstruction, because when we gain weight, we kind of gain it everywhere, of course, but our throat and our airway become more compromised because while the airway gets crunched and collapsed, the airway of a person who's overweight can tend to look like a lot like a funnel where it's just closing in on itself. And the obstructions can cause, of course, stoppages in breathing. Maintaining healthy weight keeps your apnea and your airways clear. Okay. If you've ever felt like you can feel and drop your chin, if you drop your chin to your chest, you can feel the airway closing. Versus if you put your chin up and open, that's what the difference between somebody who'd be overweight, feeling it closed, versus up and your nose up and you can feel it open up. The airway, by losing modest weight reduction, it can eliminate the need for a CPAP machine. It can eliminate the need for upper airway surgery. Now, obviously, with weight loss, if you gain that weight back, sleep apnea comes back. There's a kind of a dynamic weight rule about the amount of weight that a person needs to lose. A general initial chunk of weight that a person can look at losing is about 10% of current body weight. Okay. So a 200-pound person, that's 20 pounds. Okay. The most effective weight loss percentage is 20% or greater. It's a 200-pound person losing 40 pounds or more, getting down to 160 or less. And, a lot of people have this weight to lose, but weight loss is also work, which of course we have programs available to help with weight loss. Altering sleep position. Okay. This is a topic. This is something we can see during your sleep study is when you have apnea and how you have your apnea. Okay, during a sleep study versus a home sleep study, which gives just yes you have it versus no you don't. An in-lab sleep study, you can see the levels of sleep. You can see the body positions. We break down how bad is your apnea on your back, how bad is it on your sides, how bad is it during deep sleep, non-deep sleep. This is all breakdowns we can see during a sleep study. More often than not, when a person is laying on their back, their apnea symptoms are worse. Okay, it's called you're in the supine position. You might hear from your provider or somebody say, "Oh, just don't sleep on your back or just lay on your sides." That's beneficial. And while there's techniques to help you stay on your sides, there's a device called the night balance, which there's going to be another talk about in a couple of days. The night balance is a device that helps prevent a person from rolling on their back. They roll on their back, the device signals the patient to roll back on their sides. Okay. If you want to learn more information about this, there's a community health talk in a few days regarding this device. But apnea symptoms on their back can be double, triple, or quadruple, like when they're aside. I was talking with a patient earlier who's on a CPAP. She's doing pretty well. She's struggling with the benefit of using treatment because her apnea is pretty mild and it's really only on her back. And we were discussing the potentials of trialing, seeing how she does on her sides versus laying straight on her back, moving around and trying to avoid back sleeping. This is something we're going to experiment with. She's going to see me in about 6 weeks to see what kind of benefit she got. Using a humidifier in the bedroom. Okay, so dry air can a lot of time yield nasal congestion, and it irritates the body and the respiratory system, causing breathing to be difficult. So using a humidifier or an air purifier and such in the air can help decrease congestion, encourage clearer breathing. You can add like lavender or peppermint, eucalyptus, and such. The essential oils have anti-inflammatory properties. Avoiding alcohol and smoking. So alcohol is a skeletal muscle relaxant. Okay. Now, me personally, I'm not much of a snorer, fortunately, but if I do happen to have a few drinks, I can tend to snore. Specifically, if I'm on my back, there's the positional, there's the alcohol situation. Plus, alcohol has a half-life, meaning that called that wonderful hangover we all hate. So that disturbs your sleep on top of the fact that your breathing is interrupted, your breathing is your throat is collapsing. You have this half-life effect of alcohol. So your sleep you might fall asleep really well, but your sleep is poor, it's disrupted. Tobacco and smoking can cause inflammation in the airway from the smoke and the heat of breathing of smoking a cigarette. I've never been a cigarette smoker. I've smoked a cigar once in a while, and I felt that that irritation in the nose and the throat. Wasn't a fan, not a big fan of that. It's not something I particularly like doing because it's just, I can feel the burn and I'm not a fan. But studies have showed that, people with sleep apnea may have a predisposition to smoking to help calm their nerves, what sleep apnea can affect. So these are a couple fun ones. This is a very interesting picture. I'll get it on in a second, but you have nasal sprays and nasal strips and such. So you get nasal sprays, something as simple as normal saline. It's something I like to use in my nose, help clear your nose out. But you can use, like, people who go with the Flonase route. People go with some of these steroids that help with the relieve congestion and get airflow moving. Of course, you get the Breathe Right strips to help open your nose. And then, of course, this guy that's this very interesting thing he's doing that's called a didgeridoo. It's an Australian musical instrument. It makes a very interesting noise. Most people, if they heard a didgeridoo, would be familiar with the sound, but not even have a clue what sound it makes unless they connected the dots. But it's incredibly familiar, especially if anybody's seen any movies that, of course, go to Australia. They're in every one of them. The idea behind this is that it can strengthen the muscles in the throat and the airway to help collapse. The studies on them was very small, 25 people. It's never been proven as an effective treatment. It's never been proven as a cure, but it's definitely something in my 12 years of being in the field that I've consistently heard as, hey, it could fix sleep apnea. It's thrown out there, and I don't know who started it, where it came from, but it's just definitely something that exists in the world of fixing sleep apnea. Then there's the wonderful surgical interventions. Okay, we have this laser-assisted uvulopalanteroplasty. That's a fun word to say. Say that 10 times fast. Of course, you have the picture on the side. It kind of gives you like an idea of what is being done here. Yeah, the uvula is being removed. The design is the soft palate and the upper airway is being reconstructed. As I showed one in the very beginning pictures, that's a part of the airway that collapses that causes the apneas. Okay, there's also a balloon sinuplasty where they go up through sinus cavities and use a balloon to blast them open a little bit, so that way there's less congestion and swelling in your face. Turbinate reductions. The idea is to do whatever you can to not only improve airflow, but remove bulk in the back of the throat. Okay, so this is a surgical intervention that an ear, nose, and throat doctor would perform. Okay. Another one it's called the UPPP, the uvulopalanteroplasty, blah, blah, blah. It's a crazy word, even harder than the last one to say. It's not done very often anymore, but it does exist. A lot of patients have got this surgery. Okay. Now, there's groups of patients that have received this surgery and it didn't work. There's a lot of reasons why I'll explain in a second. But the general concept, just like the last surgery, is to remove the bulk in the throat, in the airway, okay? It's an invasive procedure. There's a lot going on with this, removing all of that tissue. One of the problems with this particular procedure is the recovery time, okay? Now, because they're reconstructing your throat, more or less, you're not really going to eat very much or well for quite a while. So a person can lose quite a bit of weight during this time frame. And as I alluded to one of the first slides, weight loss is a really smart method to get rid of sleep apnea. So if you can't eat for a month or so, well, you're going to lose a lot of weight. So once you're healed from this procedure, all this weight loss has happened. You feel, oh my goodness, I'm sleeping better. I'm feeling better. I'm not snoring. But guess what happens? You didn't connect the dots. That was weight loss. That was your key thing. You thought it was a surgery. So eating goes back to normal. Diet restriction and stuff is back to normal. You're full blown. You can eat again. You're eating pizzas and cheeseburgers and drinking beer and having a grand old time. And all that weight comes back. Maybe it takes 6 months. Maybe it takes a year. But all of it comes back. And then the snoring comes back. The choking and gasping comes back. And you can only do this procedure once. Not like you have more uvulas and tonsils to take out. They don't grow back. So if you have any other questions, obviously you and your doctor or provider should come up with a potential game plan or solution that can help. The CPAP for treating sleep apnea is still by far the gold standard. It's the only one that I can logistically say works well enough to say this is the winner. There's other treatments and other stuff that exists that have a positive clinical benefit. CPAP is still gold standard. Oral appliances might be helpful. Inspire surgery is helpful, for those that have varying degrees of sleep apnea. But if your apnea is significant, or you might not have any of these other criteria for you to need to lose weight or anything along those lines, CPAP might be the direction that you go. You can always contact us, sleep@valleysleepcenter.com. or reach out 480-830-3900. If you want to schedule an appointment with me, I take appointments in person in the Arrowhead location, our Biltmore location, and our Scottsdale office. I do telehealth as well. So I can basically see you from your house if you want to. So, any questions? All right. George Pearson, my previous doctor told me no other options were good for me because I had a stroke, which leads me to get a sleep study, and I was told I had sleep apnea. So you see how the way those dots are connected. You did a sleep study, you have sleep apnea. The one thing you don't know is how long you've had sleep apnea. Okay, did the sleep apnea cause a stroke, or did you have a stroke from some other means? But what we can logically say and definitively say is because you have sleep apnea, treating your sleep apnea can help alleviate any sort of recurrence of a stroke. Now, treating the sleep apnea might be currently a CPAP. It might be the way you have to go, but it doesn't necessarily mean you have to live with sleep apnea for the rest of your life. Depending on the various degrees of sleep apnea, the type of sleep apnea that you have, there may be alternative solutions to get you back to a normal level to where your apnea doesn't need to be treated by a device, or maybe a other device like an oral appliance can be just as clinically effective at treating your sleep apnea. So the sleep apnea probably precursored your stroke. It potentially caused the stroke, or at least assisted in making it what it was. But you're not dead in the water by just having sleep apnea. And do we have any other questions on anything? Because we got a few minutes to sit around and answer questions, and any other chats or anything. Anybody have anything to discuss?